Endocrine system. 1. The endocrine system consists of ductless glands which secrete hormones. 1. The hormones are directly poured into circulation without the help of a duct. 2. Hormone is defined as the secretion of an endocrine gland that is transported to a site distant from its origin. The following is the body, the endocrine glands present in: 1. Pituitary gland. 2. Thyroid gland. 3. Parathyroid gland. 4. Adrenal glands, suprarenal glands. 5. Pancreas. 6. Sex glands, gonads. 7. Thymus. 8. Pineal gland, pituitary gland, hypophysis. 1. The pituitary gland is situated at the base of the brain in a hollow called sella turcica of sphenoid bone. 2. It consists of two main lobes. 1. Anterior lobe or adenohypophysis. 2. Posterior lobe or neurohypophysis. Anterior pituitary. The anterior lobe of the pituitary contains three types of cells, namely chromophobe, eosinophil, and basophil. Hormones of anterior pituitary. The anterior lobe of the pituitary secretes hormones like: 1. Growth hormone, GH. 2. Thyrotropic hormone, TSH. 3. Adrenocorticotropic hormone, ACTH. 4. Follicle stimulating hormone, FSH. 5. Luteinizing hormone, LH. 6. Luteotrophic hormone, LTH. 1. Growth hormone is necessary for the normal regulation of growth and development of the body. 2. Thyrotropic hormone regulates the synthesis of thyroid hormone in the thyroid gland. 3. Adrenocorticotropic hormone stimulates the adrenal cortex to synthesize its hormones. 4. Follicle stimulating hormone stimulates: 1. Ovary in females to synthesize estrogen. 2. Testes in males to produce spermatozoa. 1. Luteinizing hormone stimulates: 1. Ovary in females to produce progesterone. 2. Testes in males to produce testosterone. 1. Luteotrophic hormone stimulates milk production in females. Disorders of anterior pituitary. 1. Hyperthyroidism. It may occur in the form of: 1. Gigantism is caused by the overproduction of growth hormones in children. 2. Acromegaly is caused by the overproduction of growth hormones in adults. 2. Hypopituitarism. It may occur in the form of dwarfism, which is due to decreased production of growth hormone. Posterior pituitary. The posterior lobe of the pituitary secretes two hormones. They are oxytocin and vasopressin. Oxytocin, it has got two functions. 1. Contraction of the uterus during labor, delivery, and to bring about parturition, for example the birth of the baby. 2. Ejection of milk from the breast. Vasopressin, antidiuretic hormone, ADH, its functions are: 1. Decreasing urine output by increasing tubular reabsorption in the kidney. 2. Increasing blood pressure by constricting capillaries and arterioles. Thyroid gland. 1. The thyroid gland is situated in the lower part of the neck on the thyroid cartilage. 2. The thyroid gland contains two lobes, one on each side of the trachea. 3. These two lobes are connected by an isthmus which lies in front of the trachea. 3. Trachea. Structure. The thyroid gland is divided using connective tissue into several lobules. Each lobule contains several spherical cells called follicles, vesicles, alveoli or acini. Each follicle is lined by a single layer of cuboidal epithelial cells. The follicles contain a jelly-like substance called colloid. The colloid stores the thyroid hormones and releases them when needed. Secretion of thyroid hormone. The thyroid gland synthesizes and secretes two hormones, thyroxine and tridothyronine. 1. Iodide is removed from plasma and concentrated in the thyroid gland. 2. Iodide is oxidized to iodine. 3. Iodide combines with the amino acid tyrosine and forms 3. 1. Monoiodotyrosine, MIT, and 3. 2. Deodotyrosine, DIT. 4. 2 molecules of DIT combine to form thyroxine, tetraiodothyronine. 1 molecule each of DIT and MIT unite to form tridothyronine. Functions of thyroid hormones. The thyroid hormones influence growth and metabolism. 1. Increase in oxygen consumption and heat production in tissues. 2. Increase in basal metabolic rate, BMR. 3. Increase in the absorption and utilization of glucose. 4. Anabolic effects like growth promotion and protein synthesis. 5. Increase in the rate of cholesterol synthesis in the liver. 6. Myelination of the central nervous system. 7. Storage of iodine. Disorders of thyroid function. Hypothyroidism. 1. Cretinism, which occurs due to intrauterine thyroid deficiency. 2. Myxedema, which is due to thyroid deficiency occurring after birth. 2. It produces retardation of physical growth. 3. Endemic goiter, which occurs due to the deficiency of iodine in food. Hypothyroidism. 1. Graves' disease, which is due to excessive production of TSH. 2. It produces protrusion of eyeballs, rapid pulse and nervousness. Parathyroid glands. The parathyroid glands are 4 in number. They are embedded on the posterior surface of the thyroid gland, 2 lying on each side. Structure. The parathyroid glands are composed of masses of epithelial cells. The cells are of 2 types, 1. Chief cells and 2. Oxyphil cells. The chief cells secrete the parathyroid hormone, PTH, operatormone. Functions of parathyroid hormone. PTH increases the calcium level of plasma and extracellular fluid. 1. Mobilization of calcium of bone into the extracellular fluid. 2. Increased reabsorption of calcium in the renal tubule. 3. Increased absorption of calcium in the gastrointestinal tract. Disorders of parathyroid function. 1. Hyperparathyroidism produces osteitis fibrosa. 1. It is characterized by decalcification of bone leading to loss of strength and fibrous appearance. 2. Hypoparathyroidism produces hypocalcemia, which leads to tetany. Adrenal or suprarenal glands. The adrenal glands are 2 in number. 1 gland is situated on the top of each kidney. Structure. The adrenal gland can be divided into 2 parts which are different in structure and function. They are 1. An inner medulla. 2. An outer cortex. The cortex has 3 distinct layers of cells. They are 1. Zone glomerulosa is an outer layer. 2. Zone fasciculata, a middle layer. 3. Zone reticularis, an inner layer. Adrenal cortex. The adrenal cortex secretes 3 groups of hormones. 1. Mineralocorticoids. 2. Glucocorticoids. 3. Sex steroids. Mineralocorticoids. The mineralocorticoids are aldosterone and desoxycorticosterone. Glucocorticoids. The glucocorticoids are cortisol, cortisone and corticosterone. Sex steroids. 1. They are androgens, in males, and estrogens, in females. 2. These 2 hormones are similar to those produced by testes and ovaries. Disorders of adrenocortical function. 1. Hypofunction of the adrenal cortex produces Addison's disease. 1. It is characterized by loss of weight, hypotension, pigmentation of the skin, etc. 1. Hyperfunction produces Cushing's syndrome, for example moon face. 1. It is characterized by the deposition of fat on the face and neck, diabetes and hypertension. Adrenal medulla. The adrenal medulla secretes adrenaline and noradrenaline. Actions of adrenaline and noradrenaline. 1. Vasoconstriction and rise in blood pressure. 2. Contraction of the splenic capsule and release of RBCs. 3. Dilatation of the pupil. 4. Contraction of nictitating membrane in animals. 5. Relaxation of the intestine. 6. Erection of the hair due to contraction of the erector pili muscle, of hair follicles. Pancreas. 1. The pancreas lies on the posterior abdominal wall in front of the abdominal aorta and lumbar vertebrae. 2. It extends between the C-shaped curvature of the duodenum and the spleen. Structure: the pancreas contains a head, body and tail. The bulk of the pancreas contains exocrine cells called acini. These acini secrete the pancreatic juice, which is digestive in function. In between the acini, there are some endocrine cells called islets of Langerhans. Islets of Langerhans: the islets are present more in the tail portion of the pancreas. The islets contain two types of cells. 1. Alpha cells which secrete glucagon. 2. Beta cells which secrete insulin. Glucagon: it is a hormone secreted by the alpha cells of islets of Langerhans. 1. Increase in blood sugar level by mobilizing glycogen from the liver. 2. Mobilization of stored fat. 3. Release of insulin from the pancreas. Insulin: it is a hormone secreted by the beta cells of islets of Langerhans. The important action of insulin is to decrease the level of glucose in the blood. 1. Increasing glycogen synthesis but preventing a glycogen breakdown in the liver. 2. By preventing fresh synthesis of glucose gluconeogenesis. 3. Stimulating the uptake and utilization of glucose in the skeletal muscle. 4. Promoting the conversion of glucose into fat in the adipose tissue. Disorders of insulin secretion: a decrease in the synthesis of insulin produces diabetes mellitus. Sex glands gonads: the sex glands are 1. Ovaries in the female which secrete estrogen and progesterone. 2. Testes in the male which secrete androgens. Estrogen: it is the female sex hormone secreted by the ovaries. 1. Regulations of the menstrual cycle. 2. Development of secondary sex characters. The secretion of estrogen is controlled by follicle-stimulating hormone, FSH, of the anterior pituitary. Progesterone: it is also a female sex hormone secreted by the ovary. 1. Maturation and development of uterus and breast. 2. Preparation of the uterus to receive the fertilized ovum. Androgens: 1. They are male sex hormones secreted by the interstitial cells of the testes. 2. The most important androgen is testosterone. 1. Stimulation of spermatogenesis. 2. Growth of penis, scrotum and prostate. 3. Development of secondary sex characters. The secretion of androgens is controlled by the luteinizing hormone LH of the anterior pituitary. Thymus: it is a gland present in the upper chest cavity on the trachea. It lies behind the sternum but in front of the heart and arch of the aorta. It consists of 2 lobes. Each lobe consists of several lobules. The thymus is bigger at birth. It grows in size until puberty. Later, it gradually decreases in size. Functions: the thymus mostly contains lymphoid tissues. It takes part in the production of lymphocytes. A hormonal secretion of the thymus plays a role in sexual development. Pineal gland or pineal body. 1. It is a very small gland situated in the brain, below the corpus callosum and behind the third ventricle. 2. It is reddish-gray in color and measures about 10 mm in length. 3. The shape is similar to a pine cone. 4. It influences the release of gonadotropic hormones from the anterior pituitary.